Toothache is a common experience, but the story of how it develops inside the mouth is often overlooked. Imagine the mouth as a bustling city filled with residents called teeth. These sturdy citizens do their jobs every day, chewing, helping us speak, and making smiles look bright. But not all the inhabitants of this city are friendly. Small, nearly invisible organisms called bacteria live here too. Most of the time, these bacteria coexist peacefully and are kept in check by daily brushing and flossing. However, when sugars from food are left on the teeth for too long, bacteria begin to feast. They break down these sugars and produce acid as a byproduct. The trouble begins as this acid starts to attack the outer layer of the teeth, the enamel. Picture the enamel as a strong fortress wall. Over time, with repeated attacks and without proper cleaning, weak spots develop in the wall, and holes begin to form. These are cavities. If the damage continues unchecked, the acid eats through the enamel and reaches the softer, sensitive dentin layer beneath. As the sides of the fortress grow thin, cold drinks or sweet foods can create sharp, immediate sensations, signaling the onset of a toothache. If the invasion proceeds further, the bacteria and acid can reach the pulp, the innermost part of the tooth where nerves and blood vessels reside. Now, the fortress is under siege. The nerves become irritated or even infected, and pain can range from a dull ache to a sharp, throbbing agony. Other causes of toothache can also arise. Sometimes, gums suffer from inflammation or infection, known as gingivitis or periodontitis, causing pain that feels very similar to that originating in the tooth. Cracks or injury from chewing on hard objects, or even changes in temperature or pressure, can trigger discomfort as well. If left untreated, the infection or inflammation may spread beyond the tooth itself, affecting surrounding gums, jawbone, or even other parts of the body in severe cases. This is why dentists are the wise guardians of this city, trained to identify where the problems began, repair broken walls, and help maintain a healthy, pain-free smile for years to come. In summary, toothache usually begins with bacteria turning food residue into acid, which then damages the protective layers of a tooth until the sensitive nerves are exposed or infected. Good oral hygiene and regular dental visits are the best defenses against the rise of toothache.